Medicine is serious business. No one wants to be in a hospital waiting room. Waiting is difficult business. No one wants to wait in a hospital room. Patients feel it, the stress. Providers feel it, the mess. And in this chaos, we go behind the curtain to discover playfulness, professionalism, and personality. Medical Podcast of America is a show that gives you access to the intimate stories of our country's most lovable and talented providers. Hi, I'm Jeremy Rugerberg. Hi, I'm Jeremy. So what happened was I made a show and now you're listening to it. Congratulations to the both of us. Well, actually, and especially to you because you're doing the harder part. For the full effect, please watch us on YouTube, as there are skits and other scenes to enjoy. But if you're on iTunes or Spotify, and yes, you too, Neil Young, please put down your phone because it's dangerous and Uber Eats can wait till later. So go ahead and like and subscribe to my channel so you can ignore me later. Hi, welcome to the show. I'm so excited today to have in the studio the man, the myth, the legend, Dr. Rob Lamberts. Rob, welcome to the show.
Thanks for having me.
Yeah, just to let you know, there are some ground rules that we need to enforce. I like to tell people about them. So first rule is that pants are optional, and I see that you have opted out.
I have opted out.
All right, second, puns and or jokes are smiled upon. You want to know what actually makes me smile?
What makes you smile?
Face muscles.
Oh, that's hilarious, Jeremy.
Thank you. And the
Does
third...
sarcasm work as well?
Sarcasm is part of jokes. It's under number 2. That was the rule. And number 3, words are highly encouraged, but these words are not encouraged. And
Sounds good.
sounds good. First question, and I opened this up to Facebook and the Google, and people know that you're going to be on my show, and they wanted to know, look, Rob, what is with your love of llamas?
What? Sometimes I wonder that too, and my psychiatrist and I have worked hard on this. I had a medical blog for years and years called Musings of a Distractible Mind, and you know, I would write about medical stuff, but it was also my sense of humor was on display there. I used it as a tool to entertain my readers. And so I would sometimes find articles that were silly articles, like a guy who had a dance studio that he had llamas dancing with people. And so I wrote about that, and it kind of got to be this ongoing meme within my blog. And so I would, every once in a while, just mention llamas, and eventually I started doing limericks that I called llamericks. And so we had I had a blog called Llamericks too for a while. And then once Facebook came out, everybody is starting to send me pictures of llamas all the times, and even my kids got into it and started, like, Christmas, I'll undoubtedly get llama paraphernalia. So I just kind of decided, even though, am I personally enamored with llamas? Not especially, but I think they're quirky and funny, and it's just kind of, it's a Rob thing now. So
I love it. And a lot of us were formative. We watched Sesame Street, Grover and Bert and Ernie and all that when we were about 7 years old and before. In what ways are you still 7 years old?
Oh, gosh, a lot of ways. I mean, I just like to be goofy. I just like to, I mean, I don't know. I think that childishness is, I mean, even with my patients, I do silly voice messages. It's not really 7 years old, but I just like to chuckle and laugh about things, and, you know, I don't know, wear silly socks or wear
No pants.
No pants, yeah. I don't do that in my office, though. I don't want to get arrested, so that's
Just in the waiting room,
Just-
not in the office.
no, just in my office when I'm sitting at my desk, but they don't know.
Seinfeld he does a good bit about pants off. Like, why does the doctor always want my pants off? Like, getting this, now you got out of the waiting room to a small room and I don't have pants. Why does the doctor always want my pants off? Like, my head hurts. Take your pants off.
Yeah,
I have a
well.
sore throat. Get those pants off. Is that something they teach you in medical school?
No,
here?
they don't teach us that in medical school. In fact, I generally don't do that with my patients. Although, it is interesting because as a doctor, one of the things you realize is that we get to do things that would be illegal in pretty much most every other setting, like putting your hand down a person's shirt or, telling them to take their pants off or sticking your finger. Well, never mind. But if you did a lot of these things in other contexts, and that to me is actually one of those things of it's important to gain people's trust, and some of that is, I think in the past in healthcare, a lot of folks have, and I'm getting a little serious here, but figure is that on limits or is it just goofiness?
Oh, no, we're going to get serious.
Okay.
Yeah.
I think a lot of the thing that you see in healthcare, doctors used to be on this ivory tower. We used to have this secret knowledge that nobody else had. Well, internet comes along and everybody has access to the same information that I have. And so it's a question of how to use it. And so it's more important for us to not approach it like we're somehow a high priest of information, but rather we are a trusted advisor and such. And so for me being real, me being normal, somebody that's approachable is, especially as primary care doctor, you really want to feel comfortable walking into your primary care doctor's office and not feel like they're always going to tell you to take their pants off, or make you feel stupid that you gained weight or whatever.
Wearing sweaters, cardigans, and being humorous.
Exactly.
All at the same time.
All at the same time.
Yeah, I agree, and I can't wait. We're going to dive into some of these things. I brought your article that you had written earlier in the magazine, and I wanted to really jump into some of those things that set you apart and why you do what you do and how you've been able to be successful in that. You do have someone in your life. This is kind of getting personal. She's soft. She's got a great coat of hair, sexy, and she goes by the name of Toot.
She does.
Can you explain how your cat came into your life?
It was actually about a year ago, and we went on to this. I went on to this website called Tinder for Cats. I think it was Kinder was actually what it was called, and
I think that means
she
children.
saw my picture and she swiped right, and that's kind of the way it was. I had actually a friend Shay, who has a bunch of cats, and had Toot showed up at her work door, and didn't have any identifying information, and so she took her in. Well, it turns out Toot doesn't play well with other cats, and so basically on New Year's Eve, Shay is like, Rob, do you understand that you're thinking about maybe a dog or a cat? And I'm wondering if you'd be interested in getting a cat. And I'm like, yeah, I could try it out. And she just kind of raised her eyebrows, try it out. Yeah. It was really within a day or two, I was totally, an obnoxious cat dad, a little black cat. And her name was actually Phoebe at that point in time. And so I was trying to figure out a more memorable name, and just the way that she meowed was kind of little. She did this little toot that sounded like a party horn, almost like that, and so I thought, oh, that's a good name. So every once in a while she'll toot at me, and usually when people toot at you, it's not a good thing, but in her case, it's pretty cute.
Well, I have gotten to meet Toot before, and she is pretty awesome. Well, let's pivot for a minute. So, so much of what we've discussed over the past 2 years in the medical space is COVID. Many are so tired of hearing about it, and I am too. So, my next question is, in what ways do you think COVID has helped reform and evolve our modern healthcare system? Because I say this because you were doing telemed way back in 2018, right, with direct primary care before all of this happened. But, now people, I feel like, are starting to catch up with you. or
Actually,
you in the DPC model. So
2013 is when I started doing telemedicine. So,
Okay.
we started doing stuff very early on. I do think that is part of it, where you're starting to look at healthcare apart from the episodic, forcing the office visit, forcing people to come in and get care. The problem is that the business model doesn't work for that. But I honestly think that that COVID forced people to look at alternative models, and it helped. But all in all, I think there's a real damage that has been done as far as trust in the science, trust in the medical field to some extent. People look at the CDC not as the source of good answers, but I don't trust their information because they're biased. I hope they're not biased, because I certainly rely on the information that they get. The
empirical data, hopefully, right?
One of the things I tell people is that folks who are reluctant as far as vaccines and that type of stuff goes, one of the first things I'll say to them is, look, I understand that when somebody says, look, the government and the drug companies want you to trust them with the information. I understand the hesitancy there. I actually opted out of Medicare. I opted out of the healthcare system as it is, and went into a system that where I'm actually no longer on the grid as far as the government is concerned. So I get that, and that's actually, I think, gives me some legitimacy when I talk to my patients, because they know that I'm not
getting a kickback.
Big Brother's not looking over my shoulder either. There's this idea that somehow if we don't prescribe ivermectin for people, if we prescribe that for people, then I've had folks saying that the AMA is going to get our licenses taken away. Well, number one, I'm not a member of the AMA. Number two, they have no control over licenses, and actually neither does the federal government. It's actually a state thing that happens. So, but I can actually say to people, look. I don't trust the government either. Certainly not to help me with my get me paid for your health care. I don't want that looking over my shoulders. And so once I opted out of Medicare, it was this great feeling of relief and freedom, knowing that I was not going to be looked over my shoulder by Big Brother, and nobody has access to my records. No insurance companies looking over them either, which is good. It puts me in a trusted position, but I tell you, it's so hard, because the problem is that people are now going to alternative sources for information, and most of those sources are. One guy sent me a video of this doctor from Trinidad who was talking about how the COVID vaccine is a weaponized. They use the term weaponized. Well, the guy was a doctor, but he was a doctor of theology.
Oh, no.
It's like, okay, so good. That's great. I understand, but I don't understand why you being on YouTube getting, and again, there's so many people who like to grandstand and get their moment of fame, but
yeah, it's very sensational.
Well, and the truth is, when I'm making a decision, I'm trying to really make it for my patient's best interest. And I emphasize to them that, people say, well, would you prescribe me ivermectin, for example? And it may or may not work. I don't know. There's studies that are kind of out, and things are a little bit iffy, but it's definitely not a game changer, as some people would want you to believe. I say, look, if I got COVID, or if my elderly parents got COVID, or if my kids got COVID, I wouldn't give it to them. Not at this point with what I know.
Mm-hmm.
And that's the thing, is hopefully at that point in time, at least I can have a dialogue. And I've had some folks who are completely, well, I don't agree with you. This is a game changer. It's like, that's fine. I'm not going to give you, if you're an auto mechanic, I'm not going to tell you all about car stuff. I don't know how people have the ability to think they know more about medicine than I do. But, again, sometimes they do.
Yeah, I agree with you. A lot of it, going back to what you said earlier, was everyone has essentially access to the same information, but your talent is been able to interpret it, distill it, and then apply it in the context of what you know in your experience in medical care.
Context is the most important word, because people are like, well, I'll send them their lab results, and I sent them an actual copy of it, but they'll see this number that really, honestly, in my entire medical career, I've never used. The MCHC is low. It's like, what does that mean? It doesn't mean anything, trust me. And then they look it up and say it's associated with cancer. Well, that's not, in the context of somebody who's basically otherwise healthy, it could go low in a cancer situation, but lots of other numbers would go first. But the idea of context, the idea of, we want to make these sweeping statements. We want to say, well, statin drugs are terrible for cholesterol lowering. And that's just not true. They are overused, or antidepressants. They're bad things. No, they're very good in some cases. Now, they are overused and they're bad in other cases. And the ability to say, look, this is true in context. And when people say, well, what do you think about cholesterol medicines? I say, think about cholesterol medicines the same way that I think about appendectomies. They're good if you need them. But don't do them if you don't need them. You don't want your appendix taken out just because your surgeon needs some money for a yacht or something like that. That's absolutely true.
Yeah.
But again, people are careless with prescribing things, and the key is to take the time, explain to people, and go from there.
Rob, wake up. What? Wake up, man. You fell asleep. You've been working so hard.
I have been.
Yeah, I tell you what, let me just get you in a taxi and get you
I had
home.
this weird dream.
Yeah?
Yeah.
All right, well,
really
listen.
crazy.
No,
I gotta pay.
No. I got it. We just got to get you home. All right. Waitress? Welcome back. If you are enjoying this so far, go ahead and hit the like and subscribe button to my channel. Okay. Rob, in 2018, you were actually the front cover provider on the front of MP Augusta. By the way, I don't know if you knew, but since we've launched MP and all these other markets, the people that I have on the ground doing it, they have been using your magazine as the example that they go and talk to people. So you are like uber famous. I don't know if you could be more famous in life than you already are just because of this magazine.
Well, yeah, but it was actually the centerfold really helped out too. So
it was the it was the deerskin bikini that
that's true. Woo. My mom was actually not the deerskin bikini part, but my mom was actually so proud of that. She she got a copy of that and shows it off to all her friends.
Well, she should.
Uh-huh.
It's a damn good magazine.
Uh-huh.
You did a great job. But I'll bring that up to say, you wrote this in there, and I wanted to get your perspective on it. This is in 2018. You said, expect more from your doctor. I think people have too low of an expectation from healthcare, and their low expectations are because nobody is showing how good care can be. Can you explain your tagline, expect more from your doctor, and can you kind of tease that out in some more specifics?
I mean, it's essentially saying, look, healthcare can be, I mean, the problems in healthcare are not the fact that the doctors aren't smart enough or they're not good enough, or even, I mean, they're being essentially rewarded for doing the wrong things. I mentioned this in my TED Talk, actually. If you look at the 4 things that the typical primary care doctor wants out of their patients, they want them to be as sick as possible. They want to bring them in for every stupid thing possible. They want to do as many procedures on them as possible. And they want to spend as little time with each one as they possibly can. And none of those those are all rewarded by the current fee-for-service system. And again, we're not talking about huge costs because primary care, it's never expensive. Mm-hmm. And so you detach that from the insurance system, and then suddenly, is it reasonable for your primary care doctor to give you an hour time to get to know you at the start? Yeah. But how many people expect that when they go to the doctor, of spending an hour sitting and talking with their physician? Or how many people expect to have a long discussion? I'll be talking about medical problems with people, and it's only at like minute 25, because I give half an hour pretty much for all my patients. That's the typical time, except for new patients, they get an hour. But oftentimes it's like at minute 25, then suddenly we're hitting on topics, and I ask a question and something comes out. Well, in the typical office visit where you got 5 minutes to talk about stuff, I mean, these are people who are coming in for upper respiratory infections, but they feel comfortable enough with you and say, well, it just feels tight in my chest, but it was feeling tight before. Or, when I swallow, stuff gets stuck, or, just all of these little details that don't necessarily come out. Most of the time, I mean, if somebody comes in with a vague diagnosis like fatigue or dizziness or something like that, there's a lot of times where you just don't know what's going on. And the idea is to just talk to them, come with a plan, discuss things, and listen to what they're saying, but it takes time to do that.
How did you start in medicine? What's the Cliff Notes version?
Well, the Cliff Notes is that I went into college actually wanting to be a musician. I started as a voice major in college, but really didn't want to sing in opera, and didn't want to be a music teacher or that kind of stuff. And so I quickly realized that really wasn't going to be my career. And I was also good at science, so I actually got a chemistry major, but didn't feel like I would do research or that kind of stuff. So what combines science and interpersonal things? Because I'm an extrovert. I like to be around people. I get charged up being around people.
It's hard to tell.
That's right. But that's the thing, is I like problem solving, like doing all those types of things. So what combines those? And medicine was one of the main things. And so I kind of backed into it. Most folks had this idea they'd be a doctor their whole life. And I actually, when I was in medical school, when I was in college, all the pre-meds were assholes. They were not the kind of people that I really liked to be around. They were all kind of, I don't know, grade hungry. They were willing to take easy classes to get better grades. But I just kind of thought, this actually seems like it could be my thing. And that's how I became a doctor. It just made sense to me.
Now, how is your business practice unique in our community? So tell us more about DPC, direct primary care, and why that was attractive to you. Because you were the first person to start this here in Augusta.
Yeah, I was kind of one of the first. I mean, there were maybe 100 practices around the country doing direct care. Direct care, a lot of folks have heard about concierge practices, which are really high-end folks, basically taking care of rich people who can afford to have a doctor to spend extra time with them. But I was made aware of this model that is essentially the same sort of thing where you're paid on a monthly basis, but it's a lot lower cost. So you don't accept insurance. And so you get paid directly from the patient. And the other thing is that you're not paid on a per visit basis, you're paid on a monthly basis. And so it frees you up to do things like spend extra time with people, to not worry about having your office be totally packed full, because it doesn't matter. If I see 2 patients in a day or if I see 15 patients in a day, I'm paid the same. It doesn't matter. And so I'm motivated to try and handle problems in a way that doesn't make my day get all full and crazy. And the other thing is this idea that says, auto insurance is for big problems. It's not for changing your oil. It's not for changing your tires. It's not for doing all those things. So why would we use health insurance to pay for something that's not expensive? Why do primary care that way? Why not uncouple what we're doing from the rest of the insurance system, from the rest of the healthcare system? 9 years ago, I always say my sobriety date from insurance money is September 30th, 2012. So I'm 9 years sober.
And you are a physician in recovery.
I'm a physician in recovery. And it's kind of like an abusive relationship that you had with the insurance companies and with Medicare and that type of stuff. Certainly as a primary care doctor, you just went home feeling exhausted and emotionally beat up. And it wasn't because of the patients; it was because of the system. Mm-hmm. And so I found out about this, and I was crazy enough to say, well, let's give it a try. It just made so much sense. It just clicked. It was like, okay, this is what I got to do. And you charge between, on average about $50 a month to get all your care. And then we do everything to try and keep the cost down, to keep you from coming to the office too much, to help you out, handle stuff via text message or over the phone or whatever. It works. 2 years ago, I had Ed Boland, who's a physician, and then Davis Mellick and his wife, who are both PAs, and they actually did the same sort of practice. And now we're actually even working on something called Welcome Health, which is going to be a new venture where we provide the backbone for of the technology, of the nursing services, of all of the central services, and can franchise out to doctors or maybe mid-level providers, and be able to say, okay, here's how you do it with as low of a risk. You don't have to spend your retirement like I did. Mm-hmm. You don't have to go through those lean years like that. We can get you up and running. We can make the deals with businesses that, there are businesses that want to be able, small businesses want to offer our services to their employees, because it adds to retention. It gives better care to their employees and makes them, it's an extra service. It only costs $50 per month.
Per employee.
Per employee, or thereabouts. Actual numbers may vary. This is not contractual.
Healthcare is one of the only industries I know of. Think of it, the automotive industry was like, hey, my car's making a noise. How much is it going to be? And they're like, yeah, it could be like $50 or $50,000.
Yeah.
We're not sure, but we'll tell you in 3 months. And you're like, no, I need to know now.
And pharmacies are the same way. If you go to a pharmacy, how much does this medicine cost? Well, it depends on your it's like going to the grocery store and have no prices listed in the grocery store. It's just so stupid.
And then you buy something, and then you get a bill later, like, the peanut butter was $3,000. I wouldn't have gotten it.
Yeah, exactly. I would have gotten the Nutella at least if it was that expensive.
You also mentioned a while ago, too, that healthcare is access. So in your model, the DPC model, it is your model. I'm kidding. The model of DPC that you utilize allows you to have the kind of access that you've always wanted with patients, correct?
Yeah, what I realized is that if there is something that I'm selling to my patients, if there is something that I'm selling to the businesses with the Welcome Health, the idea is it healthcare that I'm selling? Maybe, but really what people want above what I offer in healthcare is they want to be able to access my nurses, access me when they need me. And that's the whole idea. That's why the word welcome is in there. It's this idea of saying the door is open. In my old practice, when patients would call, it was almost as if the nurses were trying to protect me from my patients, because so many people wanted to get information off of me so that they can avoid an office visit and avoid a charge. They wanted to do that. And so we'd kind of hold off and force them to come in for that kind of thing, because that's what that business model promotes. In my practice, it's like, yeah, let's hear. People are like, I'm sick. Well, what's going on? Well, yada, yada. Well, what about this? And we can have this ongoing conversation with people, whether it's via text message, whether it's via, email or on the phone or just over a period of time. And so that's the idea of access.
Do you think this is applicable or possible within the specialty, subspecialty space? Because this is where it gets far more complicated.
No, but see, I don't think it needs to be. Yes, in some ways, I actually go to a dentist that offers, you pay a monthly fee and you get all your services, on a regular basis. You can get them cheaper, and it's a subscription model for folks who don't have dental insurance. And since I'm a small business owner, I don't have good dental insurance. So, but the idea is that, there's some specialties that might work for diabetologists, weight loss doctors, veterinarians, it actually would work really well.
Would it work with chiropractics?
It might, because they have long-term relationships with folks. And so I do think, the idea is to promote wellness. And wellness is just kind of this catchphrase that people put out there. And usually it's kind of bullshit. It's just one of those things that people throw out there to kind of sound like
it's Hallmark. It's live, laugh, love.
Yeah, it's like, but the truth is, if you're healthy, the healthcare system is not going to make much money off of you. The problem is we're talking about two separate things. We're talking about this caring, and then we're talking about this business that's a billion-dollar industry. And the answer is, you got to align those two together. And so, yes, if something like chiropractic, if something, even certain physical therapy type of things, you could do those types of things. But generally, it's somebody who has a long-term relationship with their provider.
We could talk. I have so many questions for you on this. I wanted to pivot really quickly and just ask you a few fun personal questions.
Sure.
We can spitball real quick. You are a singer. Some say you are a singer-songwriter. Actually, you used to say that about yourself. But your favorite song to sing karaoke style would be what?
Billy Joel, New York State of Mind. You know that.
I do, but I had to hear it from you.
Absolutely.
And you sang that at one of our soirees. It was awesome. What are some of your favorite styles of music?
Well, that's a good question. I can tell you the bands that I am currently. I like Nickel Creek and Waylon Jennings and Waylon Jennings. I don't know if you've heard them, but it's a female trio. They're just incredibly good. Keb Mo has gotten
like
to
Alison Krauss-ish.
Alison Krauss-ish, and Keb Mo is a blues.
Keb Mo is fantastic.
He's great. I love him, and he's just a super nice guy too.
He really is. He radiates joy.
He does. He's blues, but he's
happy
guy.
Happy
blues. That's the thing. Life is Beautiful is one of his most famous songs. So I like Cake a lot. I love the energy of Cake. I like, I just kind of, Foo Fighters, I listen to them a lot.
They just dropped a new album.
Yeah. I like to keep it diverse, truthfully.
You are a beer guy.
I am.
And you have a beard. And sometimes the beer foam gets stuck in your beard.
Yes, it does.
Do you have a favorite beer right now?
Well, one of my all-time favorites is...
Can I guess?
Yes.
Mich Ultra?
No, I call that pre-urine. One of the best beers I've had recently, it's Wild Bleep Brewery out of LaGrange, Georgia. It's like, they don't make bad beer. There is and again, if I never like donut-flavored stuff, pumpkin-flavored stuff, but it's a pumpkin donut beer, and it is amazing. It is sweet. It has a little sweetness on the end of it, and it's not overly pumpkin. Oh gosh.
All right. Well, last question then is, for what are you most grateful for today?
Well, oh gosh, I'll say two things. First is I am grateful for my parents. I've got two absolutely wonderful parents who mom is 91, dad's 95 years old, and they're both still living independently. And they are some of the best people. You know, I grew up in a strange culture where my dad was a PhD in physics, very science oriented and that type of stuff, but also very, very Christian. But they were the kind of Christians that had people staying at our house who needed it. You know, people who were, they just took care of people. They just saw love as the main image of their faith, the main showing of their faith. And they have so many people out there who see them as second parents. And so I'm just so lucky to have my parents. They're just such amazing people. And to have them around, we just did their 70th wedding anniversary, actually. Wow. And you know, that is so fortunate. And the last I'd say, I've got a wonderful woman right now.
Does Toot know about this woman?
Toot knows about her.
Okay, she
Toot
agrees.
approves
She
of her,
approves.
and yes, she does. Beth is just when you meet somebody who is truly compatible with you, it's just easy. It's just, I'd never say that about a relationship being easy. We both kind of keep looking, saying, okay, well, where's the trap door? You know, where does Alan Funt got to come out and say, yeah, this is all just a joke. She's not real. But she's my anchor emotionally.
Well, I'm happy for you, and congratulations on finding yet another woman.
Yet another woman?
Well, you have Toot. You have Toot.
Oh, yeah, Toot. Okay.
Okay. And Mom, Dad, you should be really proud of this guy. So I hope you're watching this podcast, but you should also be very proud of him. He is making a big difference in Augusta, and not just in the provider space, but within the patient space as well. Rob, thank you for being on the show. We'll have to have you come back on this.
Anytime.
All right. Thanks.
See ya.
That's a wrap. Thanks for joining us on the show. Stay tuned for the next show, where we will be interviewing another awesome person. And while you're at it, go ahead and like and subscribe to this channel.